So we'll start with Dr. David Mao, who is the Chief Executive Officer for Cerebral Health, a leading mental health company committed to providing access to high quality care. David?
Thank you, Dr. Helen. Thanks for having me here. So I might start by just mentioning how important diversity is and how important diversity interfaces with stigma when it comes to the delivery of mental health care. So I'm a psychiatrist by training. And what I can share with you is that when I, as a Chinese American, decided to go into the field of psychiatry, I was met with quite a bit of a challenge and stigma myself. So a number of my Chinese American friends, colleagues, and even professors at Harvard Medical School pulled me aside and told me, this is not a field you want to go into. This is not something you want to do. And this is in a progressive city of Boston, and just wanted to share how challenging it is for clinicians on that side. And on the other side, patients as well. So I can't tell you how many Chinese Americans have come up to me and mentioned that they want therapy or they need care for their mental health care, but they don't want me to take notes. They don't want the clinician to take notes in the off chance that this gets found out and their parents or their family knows that they're seeking care for mental health. So there is a major barrier and for people of different ethnic backgrounds where the culture is very much against seeking mental health care that we have to battle. And so one of the solutions is through telehealth. Next slide, please. So Cerebral is a mental health company. We're all telehealth. And so we provide both talk therapy as well as medication management online. We've treated close to 1 million patients to date, and we have about 1,500 clinicians in all 50 states. And most critically, we have a diverse clinician base by design. So about 50% of our clinicians self-identify as non-white, and we'll provide more details in the next slide. A few things about telehealth that makes access better for those populations that have historically been disenfranchised from mental health care. One is you can get them to care quickly. Typically, patients can wait months before they can see their first psychiatrist or their therapist, and we get them to care within 5 days. The diversity here is very, very important because I would posit that for all specialties of medicine, it's important to cater to the patient's preference when it comes to what they prefer to see in their provider. But I would argue that for psychiatry and mental health, that is especially important. So for example, if someone comes in and they say, I wish to see a female therapist who's African-American, who has experience in trauma-informed care, it is very important to match them with someone from that background if you can. And because sharing that same cultural background, sharing the same intuitions, just allows for that trust and that bond to be built faster. And we owe it to our patients to be able to do that. Historically, that hasn't been the case because it's the mentality has always been next man up, next woman up, whoever's available, you get that care from that clinician. And again, being in all 50 states is very critical for our rural populations. Next slide. Here's a breakdown of the clinician base that we have. And just to give you a sense here, one of the reasons that we're able to maintain a diverse clinician base is because we encourage our clinicians to refer other clinicians into the provider network. And that matters and becomes a very positive virtuous cycle because the clinicians themselves, they actually also enjoy working with populations that historically have not been able to get care. And so they have a diverse patient panel as well. Next slide. We can get availability is certainly quick here, and certainly when we have matching that I talked about earlier, it becomes really important because it actually increases adherence to care in a clear way. Next slide. What I wanted to also mention as a last point here is that it's not just ethnic, racial diversity that really matters. I'll give you a story. We had a patient who was taking his therapy sessions from his pickup truck. And when we asked, why are you in your pickup truck? He waited for a second. He's a Caucasian man. And he mentioned, well, I'm not ready to tell my wife that I have severe depression. I don't want to tell my kids. And I don't make enough money to have a private office at work where I can take these calls. And I'm sick and tired of you doctors forcing me to meet you where you are. You have to meet me where I am. And that's really become a calling card for us. We understand that stigma is a problem for multiple dimensions, whether it's socioeconomic or ethnic background or cultural background. And we shouldn't expect our patients to overcome that stigma in order to get care. They deserve care where they are, and we have to meet them where they are. Thank you.
Oh, thanks so much, Dr. Mao, for that insightful presentation.